Hello, greetings everybody. I'm Dr. Anjali Taneja, consultant obs and gynae from Approval Cradle Hospital, Indrapuram. So many of you may have attended our previous session in which we talked about first trimester in pregnancy, that is the initial 3 months. So here we are taking forward our journey. So congratulations, you have been through the first trimester. The initial 3 months have been crossed, and now you are in the middle 3 months of pregnancy, that is from week 13 to week 28. So this trimester is a turning point for both mother and the baby. Mother usually begins to feel better, appetite returns, the sense of general well-being comes back. The first trimester symptoms like feeling fatigue, nausea, headaches, the tenderness in the breast eases out. So what is happening with the baby? The baby has now formed all its organs and the system and will now continue to begin growing in length and weight, and it is actually now like a miniature version of what it will be when born in the world. The baby weighs around 50 grams, and by the end of 28 weeks, the weight is around 800 grams. So, congratulations again. Second trimester for most females is the easiest 3 months of the pregnancy. The nausea has been passed, the baby is not too big to cause you any discomfort. But then, yes, there are more pregnancy symptoms which are on the horizon. So what do you expect right now? There are certain changes which you will experience in your body. Weight gain starts. Many of you were worried that initial 3 months we were not gaining weight. Few of the females would have actually ended up losing weight. So now is the time that you will be gaining weight to the tune of around 200 to 500 grams per week. For pregnant moms who are pregnant with twins, it could be even more. Your belly and breast start to grow. As the uterus, the womb grows and expands to make room for the baby. The breast will also grow. This could be because of the hormonal changes, the increased blood flow to the breast tissue and glands, and fat also builds up around the breast and milk glands to prepare them for the breastfeeding when the baby arrives. Many of you complain of discomfort, pain in the breast around that time. So, a supportive bra with white straps could be helpful around this time. You may notice a thick yellowish substance leak from your breast. Don't worry, this is cholesterol, the early milk, which is important for your baby, and it just shows that the nature is preparing you for the breastfeed. You may feel a lot warmer. Now the winters are approaching, but many females will say कि मुझे बहुत गर्मी लगती है, मेरे को तो स्वेटर की जरूरत ही नहीं लगती है, which is okay because of the increasing blood volume, heart rate. You may actually feel a lot warmer than the people around you, which is okay. Many of you will complain of dull aching pain, which is bothersome also at times in the lower abdomen. And your doctor will say this is round ligament pain. So, what is round ligament? Round ligament is basically a fiber which connects your womb to the surrounding pelvic tissues. So, your womb, which is expanding right now, along with it, the ligament also stretches to accommodate this growth of the womb. So, this stretch causes pain, a cramp like pain, which can be felt as a dull ache in the lower abdomen, or it can be felt as a sharp stab of pain, especially when you're trying to move or getting up. But don't worry, this pain is harmless for the baby and it does not harm the baby by any means. What can you do for it? You can try a warm, relaxing bath. Try taking a warm water bottle tapped in a towel, and then you can try with that. Relaxation exercises under care can be tried, or simply changing your body's position and see what suits you better. You can also use maternity belt for support. That will also help you. Now there is a term called as symphysis pubic dysfunction. Few of you may have been told to have this by your doctor. Symphysis pubis dysfunction, what is it? So basically the just a minute. Sorry for the interruption. So we were talking about symphysis pubic with function. So basically, our pelvic bone down below is made up of three bones, which are joined by a material that we medically call as cartilage. During pregnancy, our joints soften out, the cartilage soften out, which allows kind of gliding movement of these bones. This is what is causing this sharp pain down below. This is usually felt as a sharp pain between the legs and can be very troublesome. So, what can you do for it? Simply icing your pelvic area may help. If required, you can take a simple painkiller over the counter. Crocin can help you. What measures you can take? Avoid heels, use comfort soles, avoid sitting or standing with your legs apart. So when you're uh, getting up from the chair or you're getting stepping out of a car, so you have to make sure that your legs move alongside. Turning sides in the bed. That time also you have to take the same precaution. Take baby steps when you're walking. Avoid long steps. Few patients may actually need medication or physiotherapy. Many of the females will complain of backache around this time. So the extra weight that is being gained in the last few months of pregnancy, it starts to put pressure on your spine from where the nerves originate. So it basically causes compression on the spine, the nerve, which makes it achy and sore. So what can you do to ease this pressure? Maintain posture. Maintain do a constant effort to maintain your posture upright. Sit up straight. You can use a chair that provides a good back support. Sleep on your side with a pillow tucked between your legs. Avoid picking up anything that is too heavy and wear low-heeled comfortable shoes with a good arch support. You may also notice some shortness of breath around this time, which is again as the growing womb is putting pressure on your legs, uh, making the breathing difficult. Growing uterus can also put pressure on your bladder. So you may have accidental urinary leakage or a sudden urge to pee. Many of you will also notice that your womb suddenly contracts. You may feel that suddenly, maybe few times a day or few times a week, I suddenly feel some contraction like thing. So these are not real contractions and they're generally painless. Neither are they sign of labor, but they are normal symptoms. They come and go at random and are more likely to occur in afternoon and evening or after physical activity. They often cause discomfort than pain. However, if they're too frequent or lasting too long, do contact your healthcare provider to see for the signs of preterm labor. Many of you will also notice some skin changes around this time because with the growing baby bump, you may have that pregnancy glow, or some of you may feel that there's a pigmentation around the cheek, which we call as melasma. You may also notice a dark line running from in the middle of your abdomen, which is called as linea nigra. These changes are normal and there is nothing that can be done to prevent them. So they are hormonal changes and they cannot be prevented. No miracle cream is going to prevent them. They're common and they usually fade after delivery. With growing valley bump, you may also notice stretch marks around your breast, thighs, tummy. So again, stretch marks cannot be prevented by creams or oils, but most eventually fade in intensity after delivery. So don't get too stressed about them. However, sun exposure can aggravate the issue, so if you're stepping out of the house, do apply a good sunscreen. Some females may also complain of nasal congestion and bleed around this time. Again, because of the increased blood flow in the body, the lining of the nose gets swelled up and can bleed at times. So if you are feeling having such a symptom, one, drink plenty of water. You may try using a humidifier, dab a petroleum jelly in the nose, and in case of bleed, just pinch your nose and hold your head straight, not backwards, just straight, and allow the bleeding to stop. One very common symptoms that female will complain around this time is heartburn and acidity. This is caused by the pregnancy hormone progesterone. The hormone relaxes the muscles, including the ring of muscles in your lower food pipe that normally keeps the food and acid down. So because that ring of muscle relaxes, it allows the acid in your tummy to come up and you feel heartburn. So what can you do for it? Try eating small, frequent portions of food. Avoid greasy, oily, spicy and acidic food, including the citrus fruits. Do not lie immediately post meal. Try taking a short walk post meal or use a pillow to prop yourself up. These measures should help you. Another very common complaint is constipation. Again, due to pregnancy hormones, the vitamin intake during pregnancy and decreased physical activity all contribute to it. So, eating a high fiber diet with fruits and nuts, eggs, seed, and maintaining hydration helps. Remaining physically active helps. However, few females may still need medication. Another common complaint is around this time is hemorrhoids or simply put piles. So we all know what piles are. Why they happen in pregnancy is because of constipation, because of the increased blood flow around that area, because the growing womb is putting pressure down there. But they can be very painful and very uncomfortable. So to relieve them, one, avoid constipation. Try sitting in a warm tub that we call a sitz bath. If needed, doctor prescribed pregnancy safe ointment can be used. Many females tend to feel dizzy around this time. This happens because of the changes in circulation that are occurring. It can leave you feeling dizzy. So again, drink plenty of fluids, avoid standing for long periods, and move slowly when you're getting up from a chair or a bed. If you still feel dizzy, lie down onto your side with foot and brace, that will help you. Another common complaint, a very common complaint in fact, is leg cramps. डॉक्टर मैं रात को सोती हूँ मेरी टांगे दर्द करती हैं मुझे क्रैम्प्स आते हैं मैं सो ही नहीं पाती. So it often strikes at night. So what can you do to prevent them? One, take your calcium supplementation regularly. Magnesium at times may be added by your healthcare provider to get you relief from these cramps. Try to stretch your calf muscles before bed. Stay physically active and drink plenty of liquids. Choose shoes with comfort, support, and utility. If a leg cramp strikes, just stretch the calf muscle on the affected side. That should help you. Even a hot shower, warm bath can also be helpful. Another thing that you may notice around this time is that you're feeling puffy. You're getting swelling on your face, puffiness around your fingers, the rings have become tight. This is what we call as edema. It happens because of the increased blood volume in pregnancy. The pregnant uterus is putting pressure on the major vessels in the body. So the blood from the lower half of your body is not able to return well. You may notice that this puffiness increases by the end of the day, especially in your foot area. Well, this puffiness is mostly harmless and disappears on its own post delivery, but it can be due to underlying anemia, that is less blood or less hemoglobin in your body, or a sign of high BP. So do mention it to your doctor, then who will check you for the same. So this is an important sign not to be missed. Many pregnant females will also complain of increased vaginal discharge. Because of the increased blood flow in the vaginal area, the glands tend to produce more discharge. So again, majority of the time this is not infectious and can simply be normal. So if it is sticky, clear, white, not foul smelling, not causing any other symptom, there is no itching. So it is likely that it is normal. If you, it may cause you some discomfort because of the wetness down below. So you may choose to wear a panty liner. But don't use tampon because it can introduce germs. However, if there is any smell in the discharge or an unusual color, it's green, it's curdy, thick, white, grayish, or there is a smell, pain or soreness or itching in the vaginal area, then this could indicate vaginal infection. Then that is the time your doctor may decide to treat you also. So if you have a vaginal infection, the most common is what we call as thrush or a fungal infection. It is a common, it presents as a lumpy white discharge, something like curd, and cause a lot of itching. It may also cause pain while you're trying to pass urine. So what can you do to prevent thrush? One, wear cotton garments, loose garments, allow air circulation. Wash with an unperfumed soap. Avoid any cosmetics down below. Avoid scented bath products. And stay clear of sex until it is cleared up. Urinary tract infections are also common around this time because the bladder is getting pressed by the growing uterus, so you may or may not be able to pass urine completely. At times, there may be strong urge to pass urine. You may need to go to washroom repeatedly. But if this is too frequent or painful, inform your doctor and do get yourself checked for urine infection. Because urine infections in pregnancy, if left untreated, can actually result in a kidney infection, and they can be a cause of preterm labor also. That is, your baby being born before time. Dental issues are also crop up during this time. Because of the increased blood flow, many females will complain of gum bleed. They may have tender swollen gums. So basically, the gums are more sensitive and tend to bleed easily. Use a softer toothbrush, and instead of scrubbing, rub it in a round circles slowly. So these are the things that you can do to help yourself. Now, these were the things that you may face during this trimester. Then many other frequent questions that I am trying to cover is that have been asked repeatedly in the OPD. So first being, can I sleep on my back? So as we covered in a first live session also, after 28 weeks, it suggests that sleeping on your back can increase the risk of having a stillbirth or a dead born baby. So it is better avoided. Also, sleeping straight is more likely to give you backache, constipation. So avoid sleeping straight. Instead, turn to your side and make yourself comfortable and turn to your side. देन द ऑफन वन क्वेरी कम्स कि डॉक्टर साहब मैं सोई तो करवट से थी, लेफ्ट साइड की सोई थी जैसे आपने कहा था, लेकिन जब मैं उठी तो मैं सीधी थी. That will happen, that may happen. So it's okay. Whenever you get up and find yourself in straight position, just turn your side and sleep. Right? Can my baby hear? Can I go to movie? Can I watch Netflix? These are another common set of queries that females ask. So at roughly around 9 weeks, your okay. So at roughly 9 weeks, uh, the indentations where the ear is supposed to form will appear on the baby. At around 18 weeks, the baby's ear are able to hear the first sound, and at around 24 weeks, the baby can actually hear sounds. But the sounds that they hear are what we may not actually notice. That the sounds of the mother, the sounds of mother's umbilical cord, the sounds of her beating heart. These are the sounds that the fetus is likely to hear. The surrounding sounds, they reach the baby through your tummy. So your tummy, the walls of the abdomen, then the baby is nicely cushioned in a water bag. So it is unlikely that outside voices can affect the baby, as by the time they reach the baby they'll be muffled. So unless they're too noisy or too loud, it is unlikely that the baby can make out the outside noises. But yes, they do start responding to the noises from outside by 24-25 weeks. So avoid too loud areas. So what can I expect when I visit my doctor in the second trimester? So usually in this trimester you'll be called once in 4 weeks. However, if you have any problem or any complication in your pregnancy, you may be called earlier. At each visit, your doctor will check your weight, BP, proteins in the urine, monitor your baby's growth by looking at your tummy, and listen to the baby's heart. Some tests and ultrasounds may be done. By this time, the tests which have been done will include your blood group, hemoglobin, infection screen including tests for syphilis, HIV, hepatitis B and C, rubella infection, thalassemia screen, thyroid test, and a urine test. Dating and the check for the life of in pregnancy, that is a viability scan that we have looked for the heartbeat in the baby, has already been done around 6 to 8 weeks. At 12 weeks, that is just starting of the second trimester at the end of the first trimester, you'll be advised Down syndrome screening. Now, what is Down syndrome screening and should everybody go for it? So, yes, Down syndrome is basically a genetic problem. When a baby is formed, half of the genetic material comes from the mother and half the genetic material comes from the father. Sometimes the extra genetic material comes which can cause genetic problems in the baby. Of common concerns being trisomy 21 or Down syndrome, and then others we are testing is trisomy 18 and 13. I'll not be going into details of this. So basically, a Down's baby may not be like other babies, can have some behavioral and health issues along with. So you may choose not to undergo any screening if you say I am okay with the kind of child comes. But if you say no, I want to go for screening, then what your doctor will offer you will depend on a lot of parameters, depending on your age and your family history. However, we need to remember that majority of the Downs babies are actually born to families without any medical history. So everyone should have this testing. As a baseline, you'll be offered something called as NTNB scan and a dual marker. Dual marker is a blood test. NTNB scan is an ultrasound where the pocket of fluid behind the neck of the baby is measured, the thickness is measured. And these are then combined with your age and then a software generated report is there. These are screening tests, that is, they tell the probability or the risk of having a child with or without Down syndrome. So if the probability is low and your baseline risk is low, you may opt for no further testing. However, if the baseline risk is higher or the test comes as high risk, you may be offered fetal medicine counseling and further testing may be offered, which could be in the form of test called as NIPT or amniocentesis. In some cases, you may have missed your 12 weeks visit and your marker may have been missed. In such a case, around 16 weeks, a test called as quad test will be offered to you. After that, around 18 to 20 weeks, level 2, the anomaly scan is done. And then you will be tested for diabetes in pregnancy around 24 to 28 weeks. You will also receive a tetanus, flu, and a Tdap injection, and COVID vaccination will be offered as per the guidelines of Government of India. At each visit, be sure to mention any signs or symptoms that concern you. Discussion helps. Many of things may be normal, but at times it could be a sign of underlying problems. So do mention your concerns to your healthcare provider. Now, when we get the ultrasound done, many times it shows a cord around the neck or the nuchal cord that we medically call it. So what is it? Is it dangerous? In most cases, it resolves on its own before delivery and does not usually pose any impending threat. However, in few cases, it may persist and may increase your chances of having a cesarean, but nothing is to be done for the cord around neck or if it comes on your ultrasound. Another common fear is when will my baby bump show? Is my baby growing? So it is common that a lot of women will not show baby bump by 16 to 20 weeks, that is 4 to 5th month of pregnancy. So rely on the clinical examination and the ultrasound that has been done at 12 weeks and then at 20 weeks to check the growth of your baby. When will I feel the baby movement? When will my baby start moving? The first fetal movement that you perceive is called as quickening and it can be felt from 18th week onwards. In your first pregnancy, you may feel it slightly later. In second pregnancies, you may feel it slightly earlier. Initial movements are not too strong. They may feel like bubbling, butterflies in the stomach, or simply gas. However, if you don't feel the movement by 24 weeks, do inform your doctor. I feel itchy all the time. So, your stretching of the skin may cause itchiness and dry. Moisturizers can help. However, If the itch is intense, persistent, or occurring more at night, it can be a sign of liver disorder, and that is another symptom that needs to be informed to your healthcare provider. Doctor, I want to have a 3D scan. What is 3D scan? What is 4D scan? I've heard about them. The 3D scan is basically nothing, but it is a 3D still image of your baby. 4D is the moving image. However, though ultrasound does not cause any harm to your baby, still 3D or 4D scan should be done only when medically required. We all know we are in the middle of a pandemic. We are still struggling with it. So COVID vaccine is recommended for all pregnant females. Uh, Sputnik, Moderna, Covishield, Covaxin all have been safe by Government of India. So please go for it. COVID infection during pregnancy can be more severe and result in rapid deterioration of health of pregnant women, can harm the baby also. So do consider yourself getting vaccinated if you're planning pregnancy or in any stage of pregnancy. So what are the complications that can happen during this time? You may have bleeding, you may be diagnosed with high BP, deranged sugars, short cervix, early breaking of your water bag, going into preterm labor, and less hemoglobin anemia are some common complications that can be diagnosed during this time. Are there any possible conditions in which you will be advised bed rest or you can be active? So yes, any possible complication you may be advised bed rest, like any placental complications, bleeding, short cervix. If you have a precious pregnancy, you have a history of miscarriages, it's an IVF pregnancy, then also you may be advised bed rest. High BP, or if your doctor feels you're at risk of preterm labor. Can I get massage? Can I get a massage? So massages are not advisable in early part of pregnancy. However, they are a good aid to relax your aching muscle or back. So given by a trained person, you can have them in the middle phase of pregnancy. Another thing that your doctor is likely to advise you is Kegel's exercise or the pelvic floor exercise. As we just mentioned, many of the females get urinary leak during pregnancy, which may persist even when you are delivered. So pelvic floor exercises starting during pregnancy are a good way to keep it at bay. It strengthens your muscles of the pelvic floor and can be done anytime, anywhere. They are very easy to do. You just have to contract and relax like you're trying to stop the stream of the urine. It gives you better bladder control, better pelvic recovery after childbirth, and lowers your risk of having prolapse as you age. Do I need to eat more? We have covered this question in the first live also. Still, I'll again emphasize. Feeling hungry and improve appetite is perfectly normal during this part of pregnancy. But you really don't need to eat for two. So eat healthy and eat sensibly. Approximately 300 to 350 calories per day extra is needed. However, the requirement may change depending on your pre-pregnancy weight, if you're having twins, or there is any other pregnancy complication like diabetes. Then, can I exercise? Yes, regular exercise is safe and beneficial in pregnancy, unless there is risk and you have been told by your doctor not to exercise. Exercise decreases the risk of medical complications, reduces backache, eases constipation, and controls weight gain. So check with your doctor or a trained person to see what exercises can be safe for you. As a thumb rule, you will not get breathless during exercise, don't feel too hot during exercise, and you should be able to talk. So ideal recommendation is 150 minutes of exercise per week, which actually come to maybe 30 minutes walk 5 days a week or some stretching added to it. So best sleeping position we have already discussed in the first slide, that sleeping on your back may not be safe. So sleep onto your side, preferably on the left side. Now, what is the anatomy scan that was advised around 20 weeks? So done around 20 weeks, it is a detailed scan, where the baby is scanned from head to toe for any unusual developmental appearance, right? It can pick up a range of conditions, but not all of them. So basically here the radiologist looking at the baby for the markers of genetic disorders and any other developmental structural problem. Usually the scan will show that the baby is healthy, but at times the problem may be picked up. In that case, you'll be offered management according to that. So now, what are the medicines that I'll be given? The medicines that will be routinely given will be iron, calcium, and sometimes protein powder and vitamin D supplement also, and any other medication depending on your individual medical condition. So iron is best taken with empty stomach, but empty stomach, if it is taken, it may cause some gastric upset. So you may decide to take a different brand or take it full stomach, preferably with a glass of lemon water or an orange. Try to take your calcium supplements with meals. Calcium is taken with meals because it needs acid to break down. Don't take it with too much fiber and take it preferably as smaller supplements of 500 milligram to 600 milligram at one time, which gives a better absorption. Another common question, can I work? Can I drive? So, yes, in an uncomplicated pregnancy, you can continue to work. However, do take measures to comfortable. Take frequent breaks to walk around. Keep a small footstool under your desk so that your foot end can be elevated and you get less of puffiness. Eat healthy, eat frequent, take a lot of water and rest comfortably. You can drive, but with a seat belt. The seat belt is to be tied below the belly button. I think I've tried to cover all the queries and I'll just see the chat box to see what questions. Smriti has asked what will be the symptoms for vitamin deficiency. Hello, Smriti, are you there? Hello, Smriti, are you there? Hello. Okay, so Smriti, vitamin deficiencies can depend on which vitamin we are talking of. Like vitamin B deficiencies can manifest as tingling, generalized vague forgetfulness, increased nausea and vomiting. Vitamin D can manifest as backache, bone pains. Vitamin C can manifest as cracking around the corners of the mouth. So it is a very generalized thing to talk with which vitamin deficiencies, but generally you'll be given prenatal vitamins to cover that. And if you're eating a healthy diet, generally you will not have this. Okay, so you can drink any kind of water that you want, hot or warm, doesn't matter. Depending on the weather and your personal preference, you can drink. Can my mouth smell more often due to no reason? No, we just discussed that dental problems tend to crop up in pregnancy, so your gums are basically more sensitive. They're more prone to infection. So if your mouth is smelling, you must see a dentist to see that there is no infection. Will I have urinate more often? Is it normal? Yes, you may tend to urinate more often because the baby's head or the bumps are pressing on your bladder. So this is normal. However, if it is painful or you are having any burning sensation along with urination, then it can be a sign of underlying infection and you must see a doctor. Can we use any type of cream to avoid stretch marks? No miracle cream or oil will avoid the stretch marks. However, they will make you feel comfortable because they'll moisturize the skin nice so they can make you feel comfortable. What things should I do to keep positivity and mental peace around me? First of all, stay positive, think good about your pregnancy, feel good. You may try meditation, sleep well on time, decrease your screen time, eat on time, stay hydrated, and talk to other females and other mothers, share your experience, and that should help you. Should I stay away from pet cats, dogs during this phase? Yes, cleaning cat litter should be avoided during this time. How should we keep a check that baby is not getting underweight or overweight? Okay, so like we just discussed, at 12 weeks one scan is done and 20 weeks the other scan is done, which would have checked your baby's growth. Going forward from that point, your doctor is checking you for baby's growth at every visit. At any point of time, if your doctor feels that the baby is underweight or overweight, they'll confirm it with another scan. Otherwise, a routine repeat scan is done somewhere between 28 to 32 weeks, which will again look at it. Yeah. So I think we have tried to cover all the questions. Hope you all find this session useful and feel free to contact us for any queries you may have. Thank you. Have a good pregnancy.